The following portion of Studio 512 is sponsored by Biohaven. Austin Clinical Trial Partners is one of 70 research sites in the United States conducting a clinical trial aimed at addressing MDD, or major depressive disorder. Dr. Donald J. Garcia Jr. is here to talk to us more about a current study. Dr. Garcia, if we can, from the top, let's just talk about what MDD, or major depressive disorder, actually is.
Most everybody's heard about depression, but then major depressive disorder is not really clear. We all feel depressed from time to time about things that happen in our life, but sometimes depression goes to a level where it affects us in a functional way. And major depressive disorder is a clinical diagnosis for a depression that lasts at least 2 weeks long, and it can go for weeks or months or even in some cases years. People will describe loss of interest or pleasure in activities that they normally enjoy, and they might have other symptoms like insomnia, trouble concentrating, feeling hopeless or helpless or worthless, or having changes in their appetite like undereating or overeating.
Let's talk about the clinical trial that you're recruiting for.
So here at Austin Clinical Trial Partners, we're doing a clinical trial that's sponsored by Biohaven Pharma, and the study is looking at a drug which is investigational right now. BHV 7000 is the study. It's looking at people between the age of 18 and 75 who have a clinical depression that has lasted at least 2 months long. But it's essentially looking at this novel mechanism of action that this drug has, which works in a different way than any other drug that we have right now on the market.
Okay, so how can people get some more information? Especially I think about those who think, okay, maybe I've got depression. I don't have in my hands a clinical diagnosis from a psychiatrist. If they just want to learn more and see if they are a fit for this study, how can they get in touch with you?
Well, our website, austinclinicaltrialpartners.com, is one source. And if people feel like, if any person feels like they might have a depression, they can also talk to their family doctor. Family doctors are trained at diagnosing depression and can do an assessment. There is no cost associated with participating in a clinical trial. We provide the medical evaluation. We don't bill the patient, we don't bill insurance, and that's often a question that people have who are interested. In addition, there's a small stipend that we pay for travel.
It's really interesting stuff today, Doctor. Thank you for your time.
Thank you.
For more information about the trial and how to participate, visit mddclinicalstudy.com. The preceding portion of Studio 512 was sponsored by Biohaven.